Welcome to episode 130 of the Daniel Yoris podcast with today's guest, Dr. Cory Torgerson. Let's go. Welcome back to the podcast, everybody. Attempt number 3 to get this one going with Dr. Cory Torgerson. We're just battling a few technical difficulties, but no issues there. We'll get through it. How are you doing today? Thank you for being here. Appreciate you. You know, we'll say hello again for the fourth time now.
Daniel, nice to meet you. Nice to be on your podcast.
Once again, thank you. Dr. Torgerson, again, can you please let people know who you are and what it is that you do?
Yeah, so everybody, my name is Dr. Cory Torgerson. I'm a head and neck surgeon, facial plastic surgeon, and I have a big clinic down in Yorkville called Sovereign MD. It's a big umbrella business, and one of the pillars is called Sovereign Male. And Sovereign Male sort of deals and treats with all kinds of things that dudes care about. We have a big testosterone replacement, hormone therapy replacement center where we treat like low testosterone. We deal with erectile dysfunction, which is a really big problem among males over 40 with some cool technology. We also have something pretty cool called the Big Shot. This is a trademarked treatment for male enhancement, other stuff that guys care about. So we do it all and we make everybody happy, and I'm your best friend.
How long have you been doing this, focusing on the male health and male enhancement side of things? Because this is it's not necessarily new science, but there's a lot more talk about it. It's becoming more normalized in recent years. How long have you been doing this for?
It was kind of a slow, sort of very, very organic process for me. And it started with myself about 10 years ago, where I was suffering with some of the symptoms of low testosterone. And, you know, that was really the driver that said, okay, what's happening and what do we need to do? This is an original problem. And so we became really formalized about 5 years ago. And really, as the awareness in the population, male population, has really grown, and the acceptance of saying, hey, you know what, I don't feel great, and what do I got to do to feel better and feel like myself? That's going up like crazy. So it's really exploded.
Yeah, as we all know, as you know, us two being males, and for any females who are listening, the males in your life are very reluctant to admit when something is wrong, especially something with their health. It's always something, I'll just shake it off. I'm just having a bad day. I can get over this, and then, you know, months and months and months go by with doing nothing and no repair. And that's not good, obviously. So I'm happy that collectively it seems like more men are speaking up about their health and saying, hey, this is not working for me. This is not right. Something's got to change here. And now we have centers like yours that we can actually go to be like, hey, I need some, you know, more directed help rather than just, you know, trying to Google stuff or whatever your GP might say. Not that there's anything wrong with GPs, it's just not their specialty.
Yeah, and communication platforms have changed. You know, it's just not getting information from your family doctor or even the internet. You know, social media has been a big driver. Podcasts have been a big driver of saying, okay, let's talk. Let's get out there and talk. And the more you talk about it, the more it becomes normal and becomes very ingrained into a sort of our psyche of, how do I fix this? What do I got to do?
Right. Do you think that there has been, and you might have experienced this through patients that you see, that people who hear stuff about TRT or growth hormone or just hormone replacement therapy in general, they come in and they have all these things like, hey, I heard on a podcast or I Googled this, and it's just like completely wrong or completely off, and they've been trying to do stuff on their own that's like causing more harm than good. Where do you find the balance of the available information compared to like what's actually real?
That's like with anything. The internet is awesome and it's terrible all at the same time. And, you know, when patients come in with, you know, pages and pages of downloaded information from, you know, certain collective groups that they're in, it's always a bit of a red flag, because in their brain, you know, they know more than me. They're their own doctor. And that's pretty amazing that we have a lot of information. It's always context and it's always the balance. And that's why you're never ever going to shoehorn out a medical professional, because they have a little bit more specialty training and be able to say, okay, this information is relevant and this isn't, or this is frankly just wrong. And so, you know, it's always has to be individual individualized. And so I think there's a good balance between that. It is pretty great, though. I've learned lots from my patients. Patients have come in and been, hey, I've been researching this, and what do you think about this? And I'm like, I didn't even freaking know about that. Let me go see. Wow, that's cool. Okay, but I have the ability to be able to say, okay, what does the research say? What is the information about this says? Okay, this is very rudimentary. We're going to leave it over here, park it. But wait a second, this isn't, and this is where the industry is growing. And I'm very interested in regenerative medicine and things like that. And that's probably going to be the big next push is treatments that are into regenerative medicine.
Yeah, it's something that I'm super looking forward to with myself. You wouldn't know this, but I have a big history of knee injuries, and like the way things are going, like I will need a knee replacement way earlier than I should be based on like the history of my injuries and surgeries and stuff that I've had. And it seems like, some of the new emerging regenerative medicine is probably the only thing that will prevent or prolong me from having that. So I'm super excited about that. But that's a whole other, rabbit hole that, we won't go down today. It is very interesting because in training, it's very much the same. There's so much information out there, and clients will often bring to me, most 90% of the time, it's just nonsense. Like, I heard this diet, I heard this thing, and it's like, okay, well, here's why that's nonsense, right? And you as the expert, you have to be able to hear that information and then dispel that information, like validate it or invalidate it. But sometimes it's like, oh, that's actually really interesting. I hadn't heard that before. Let me look into it with my contextual knowledge, and then I can kind of
exactly,
right? Yeah,
exactly, yeah.
Is your clinic now? For any American friends who are listening to this, our healthcare system is very different. It's mostly public healthcare system. How does your clinic integrate into that? Is this something? Can I just show up and pay to see you, or how does it work?
Yeah, well, for most of these things, it's very, very hard for, in Ontario, we have what's called the OHIP system. It's our publicly funded system. But most doctors, if you're able to even get a family doctor, that's one thing, or an appointment, maybe once or twice every 5 years, kind of a deal. Them wanting to talk about things like this where they don't have the context. It's really a door closer for most patients. And then there's a general level of frustration with no doctor wants to talk about this, or they don't know about it, or they say, I'm crazy, and yet I know I'm not. This is an issue. So most of the clinics that are specialized to deal with these kinds of things tend to be private outside of the public system where you'll pay for it. And, I will just go on the record and say with this, I'm one of those in the camps where I think that there's value to our system in Canada, but there's a lot of gaps. And in having some sort of a mixed system, especially when you look at the context of the best healthcare systems around the world, they're all mixed. They all have a mixture of private and public, and they do really well together. And I think the public gets served better overall. So my clinic entirely is private.
I'm with you on that. I know that it's a bit of a hot button topic in Ontario right now, politically and whatnot, but I'm with you. I think that the mixed system just makes the most sense. I can even say for myself, a number of years ago, I wanted to get my testosterone levels checked. I was having no symptoms. Nothing was wrong. I was just starting to hear about, low testosterone and these things. And I was like, okay, well, I think I was 21 or 22. And I was like, I want to start to get a baseline. I think that this is a normal thing. Like, let me start to get a baseline so that by the time I'm a little bit older, now I have something to work off of. Yeah. I had to lie to my doctor for 2 years, making up symptoms so that he would even listen to me, so that he could even order the blood test, which I still had to pay for anyways. And I was like, this is not even publicly funded, and you're still like begging me to do this. Like, I had to lie and figure out how to work the system to get it and then pay for it anyways. And so like that just seems not right to me.
Well, and here's the reason why, like the exact correlate in women is menopause. We know that most women go through menopause in their usually the beginning of their 40s or in their 40s. Some people earlier, some people a little later. Their ovaries poop out. They make less estrogen and progesterone. They get symptoms, and many women are treated with hormone replacement therapy. The correlate is andropause in men. 1 in 4 men over 40 have symptoms of low testosterone. Our balls poop out. We don't make as much testosterone, and we get symptoms. And, the symptoms are common, low energy, low mood, low sex drive, much harder to get the same gains with the same work in the gym in terms of building muscle or losing fat. And when you tell a doctor that you're interested in maybe checking your testosterone levels, they're like, no, you're fine. You have to talk like a red squirrel or make up stories for them to do it, because anybody looking for testosterone is a bodybuilder, steroid abuser in their mind. We have this sort of threshold where like, oh, we don't do that. And yet the grand majority of studies that have come out in the last 10, 15 years, and they're ever increasing, show that there's a tremendous benefit for optimizing a male. Optimizing is the word here, up to the high end of the normal level, because there's a range of testosterone, okay, that we know is normal. But if you had your testosterone and it was sort of like in the middle or at the low end and you're getting symptoms, we don't just treat numbers. We treat people with symptoms. And, are you going to feel something? Well, yes. Is it dangerous to bring that level up to the high end of the normal range? Well, no, it isn't, because it's still normal. Right. So we're just dealing in the range of safe and normal. And of course, that's what we want to do. Those bodybuilders who are, dosing 10 to 100 times their regular dose, well, you're going to get into some problems after a while. Your blood is going to thicken up. You're going to have a higher chance of developing blood clots, which could lead to heart attack or stroke and things like that. So we want to do this safely. But I mean, what it is education for doctors as well, because we're really in medical school and even in residency, even endocrinologists not talked about. We don't talk about andropause. We don't talk about that. Men just live with it. They suffer through it. Yeah, grandpa doesn't, Grandma and Grandpa haven't slept together for 25 years, and now he's all wizened up and his muscles are thin, and that's just age. But why do we have to live that way? Women don't. Why don't men?
Right. The steroid abuse thing is an interesting thing, and I think an important thing to make note of here, because there's a very distinct difference, and you said this, but just to reiterate it, that there's a very distinct difference between optimizing and then taking super physiological doses in order to chase a hypertrophy, which is like those people are not doing that to be healthy. They're doing it to be as big as they can. And by all means, like, do whatever you want. I don't care. But it's just like it's two different things. And that was something that my doctor, in the lying to him, he was always on me about, like, are you using steroids? Are you using steroids? I'm like, I'm 147 pounds. Like, I'm not using steroids. I just want to see what my testosterone.
They don't really get it. They don't I mean, all they have to do is be educated about it, and they'll be like, oh, well, that makes sense. Let me help you with that, right? Exactly. So that's kind of a part of it, and then that's also speaks to, hey, sometimes this internet research is really good for patients to come in and educate their doctors about stuff that they didn't really know very much about, because medicine's always advancing going forward. We're learning more things all the time.
Right. Now, another criticism of, maybe not criticism is a little bit too strong of a word, but let's roll with that for now. Criticism of using hormone replacement therapy as we age, for men and women, is that it's part of the normal aging process, is that we will lose testosterone, like women will go through menopause, and that is normal. Now, too much decline is probably abnormal. So where do we draw that line between, well, I want to stay like, energetic and strong and whatever, but I shouldn't be as energetic and strong when I'm 85 as when I was 25. So where do we draw that line?
Yeah, I mean, I think it's a philosophical debate, and what is normal? Well, death. Death is normal, okay? Our telomeres on our DNA get trimmed off and shortened as we get older, and they die, programmed cell death, and we get inflammation and disease, and we die. Our skin doesn't change, our organs don't renew, and they get old and they die. And so we have some new sort of nomenclature in our conversations, where we're not even just talking about lifespan, we're talking about health span. Yeah. Like, we want to live our best lives. We want to be healthy until it's our time. And so really it kind of fits into that. Why do we give women hormone replacement therapy? Why do we give them? Well, because they have symptoms and they don't feel good and their skin goes to pot and they get hot flashes and it's uncomfortable. I mean, is that going to kill them? No. Well, why are we doing it? Well, because it makes them feel better, and we're treating that. And so it's the same sort of thing with dudes. Why shouldn't we enjoy a healthy sex life? Why shouldn't we enjoy being strong? And I mean, there's so many benefits. There's a study that came out a couple of years ago that said there's a longevity benefit to optimizing your testosterone. There's cardiovascular benefits. There's cognitive benefits. Why don't we want to be our very best for as long as we're living? And I think that really resounds and connects with most guys. I just want to feel like myself. I don't want to feel like this old dude that life is over after 40. There are seasons in your life, to your point. Yeah, you're not the same when you're 50 as when you're 20. We see it in sports, but at the same time, why can't we be healthy and vital and with it and have an amazing health span?
Yeah, I'm inferencing here into that study that you're talking about, but I would guess that the increase or sustained level of testosterone over the lifespan may contribute itself physiologically to increased health span, but it's also probably that because of your increased testosterone, you're just a little bit more vibrant, you're more energetic, so you can continue to exercise, you feel like taking care of yourself, you continue to maintain both sexual and friendship relationships and family relationships and these things. And all of that, compounds into increased health span. Does that probably make sense?
Well, for sure. It's feed forward, right? They all influence each other. And if you're moving and you feel strong, then you're going to lift stuff and you're going to load your bones, and then they're not going to decay and all that kind of thing that we know that happens. And so you're right. And relationally as well. If you feel confident in the bedroom, then you're going to be there, and not retract and withdraw, and all that kind of that helps your mental health. There's so many things that are crossed over that are important to this. So getting out and saying, hey, it's okay to go and ask your doctor, whether you found them privately or even if your family doctor decides that they want to get into this kind of a thing. We should be doing this. This is why your podcast is critically important, Daniel.
Right. Thank you for that.
Yeah.
Why do you think that this has, all the symptoms of low testosterone, ED, and everything associated with it? Why has this increased so much over the last, 20, 30, 40 years?
Well, with regards to ED, it's interesting because a study came out and basically said that 50% of men over 40 have some level of erectile dysfunction. It's kind of a grading system. 50% is a big number, right? So we have everything from tofu penis to, an eggplant or a hard cucumber or something with some banana business in between. Okay. So there's a range. Okay. Your penis might work, but it might not be as hard as it was when you were 16 and the wind blew on it and it sprung up kind of a deal, right? And so we know that 50% of men over 40 have it, and largely this is vascular causes. Okay, our blood vessels retract in our penis. We don't have as much blood in our penis, and the smooth muscle that holds the blood in the penis and maintains the erection also retracts. So we know that happens with aging all over our body, in our limbs, and just about everywhere. But it's interesting in that study that showed, 50% of men over 40, the levels of erectile dysfunction claims in men in their 20s and 30s have also crept up by just about 10%. Well, that doesn't make sense. Why would that be? And the general thought is because we're talking about it. We're talking about it more. It's okay to say, hey, I'm kind of struggling with this, or is there something that can, I didn't feel like as good? Is there something? Of course, it just doesn't go on and off, right? And so just a general level of awareness, I think, is probably making those numbers go up and saying it's okay to talk about our boners.
Yeah, no, that's actually a really good point. And honestly, something I didn't really consider is that the numbers might be going up just because we're talking about it more.
We're talking about it.
Now, does that same thing is that also attributed to testosterone decline? Are we just testing it more, and so now we have maybe more data to support that it is lower? Because you hear these numbers, and I'm just pulling these out of my ass. These are not real, but it's like, our testosterone now is 100% less than that of our grandfathers. Is that right? Is there actual truth to that, or were we just not testing it? How do we know?
I've heard the same studies. There's we're eating too many processed foods, and there's too many Maybe it's about our technology. Who knows? The answer is We won't know. There's conjecture. Absolutely, it's possible. Are we measuring it more? Were the measurements more accurate than they were back when? I don't know, but or is it a little combination of everything? It's kind of like the correlate for me is, because I'm a head and neck surgeon, is thyroid cancer. The rates of thyroid cancer have skyrocketed around the world. Why? Is it radiation? Is it this? The general thought again is that we test it way more than we ever have, and because we test it, we find more, and that's probably more accurate. And we have better, assessment tools to be able to find it than we ever did before, not just the big ones.
Right.
And so, I think probably, I tend to think that that's probably the most, of the reason. If you can, sort of talk about your grandpa and stuff like this, they were dead when they were 60, 65. They thought their life was over. We do not have that expectation. We want to be vital, energetic, virile until the day that we die.
Yeah.
That's our general expectation, is that we want to have a great health span. So,
yeah, it almost seems to me like some of it is just attributed to like cultural differences between the times, where like our grandfathers, the stereotypical grandfather who, especially in Canada and the US, like immigrated here, worked some like, hard manual labor job, and they were just, distant and unemotional, and they were just like hard men. And so we just associate that with high testosterone. And like that may have been true, but it may not have been true. And now less of us work those kind of jobs, and we for the most part don't have, everyone's got difficulties in their life, but we don't have as hard lives as, moving to a new country with no money and no language, and like we don't have that struggle. So we're not as hard as our grandfathers were, but that doesn't necessarily mean that we just have lower testosterone. Could it be contributed to lack of exercise, changes in food and diet? Yes, but maybe not as much as it's been played up to be.
I 100% agree with you. I think that's probably really, really true. We're obviously hyper-focusing on things that we didn't have the time to hyper-focus on before, because we were busy friggin' surviving.
Yeah. Yeah.
Right?
Yeah. Yeah, when you're digging a ditch for 14 hours a day, you don't have time to go to the doctor and complain about, what's wrong with you. You just probably, you dug that ditch and then something was wrong. You just swallowed it, and then eventually you just died, and then, he had a heart attack. Oh, okay.
Exactly.
Yeah.
I think that's probably true. But I mean, on the other hand, rightly so. Like, I mean, if they had the opportunity to be able to say, "Hey, what could I do about this?" They'd be doing it just as much as we would. We really, really haven't changed that much. Right. And I always say, guys care about all the same stuff. It's just how we're being able to treat it is so much more effective than ever before. We can change someone's life when we put them on hormone replacement therapy, on testosterone replacement therapy. I remember a story when I was my brother is very, very afraid of needles, and I'm like, I can smell it. I can smell low testosterone. I'm like, I think he's got it. I said, how are you feeling? He goes, I'm tired. I don't have a sex drive. I'm just like, we should test your testosterone. So he lives in another province. He got his family doctor to get a blood work requisition. He got it. Of course, it was like not even in the realm of normal range. It was below that. And we made arrangements to have a testosterone prescription for him, and he took it, and it was like an instant shift. We were out for dinner, and he said, I feel like the sky is bluer and the grass is greener, and I feel like I'm awake. And, it was just so palpable for him. And of course, he friggin' doesn't care about needles anymore. He's like, bring it on, and so it's been a game changer, and when you can change someone's life like that, that's pretty cool.
Yeah. I mean, I guess part of that too is that the decline is not quick. It may happen over a number of years, and so then, but the solution is much faster than the decline is, and so that's when you get that turnaround, big revelation: the grass is greener, the sky is bluer type of thing. But it's been getting gray over maybe 10, 20, maybe 30 years, right?
Yeah, slowly. Yeah,
exactly. So one thing that you kind of brought up there was these ranges, and we hear a lot about the ranges of what is healthy, normal testosterone, and the ranges. I don't know what the current healthy ranges, but it's pretty wide. Why is it such a huge range?
Yeah, well, it's good. I mean, they make those ranges because they test men at different ages throughout their life, and then they just make averages, right? And so it would include the highest ranges for men that, probably are the youngest. We think about bound testosterone and free testosterone. I like to use bound testosterone because it's a little bit more accurate representation of the testosterone that's in our bloodstream, but also the testosterone that's bound to proteins and like albumin and different proteins in the blood or in the tissue, a little bit more reflective, and it's eventually available. So the bound testosterone range goes from basically, numbers, 8 to 29. Okay, or 10 to 30 in general. And, the thought is that the younger guys are going to have closer to that 30 range. And as we get older, it goes down, 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 and down. But not every dude is up at 30. We're all different. Some guys are starting at 15, all right? And they drop a little bit, and all of a sudden they're down to 9, and it's off the charts. They're not feeling great at all, okay? So it's not just necessarily andropause that causes a decline. There's other reasons to have low testosterone. Primary hypogonadism, where your testicles just didn't make a lot of testosterone to begin with, and so testosterone is associated with the dude, masculinity, and all of that. And there's lots of different guys that just don't have as much, so they're not as kind of a deal. They don't grow much hair and all that kind of stuff, and that's okay. Like, there's a range, right? And so in general, still being able to draw somebody and put them up to the high end of that range is going to have a tremendous amount of benefit. So if you're, 18 and you were starting off at 50, at 50, if you were 18 years old and your bound testosterone was 15, sort of somewhere in the middle, that's as high as it was for you. Is it wrong to get you up to 30?
I don't think so.
No, it's not wrong at all. It's still in the normal range. So being able to bring somebody up and do a treatment that actually brings great amount of satisfaction and joy and, health, for me is, are you optimizable?
Right.
Wherever you are you optimizable? And can we do it safely? That's the next thing.
Right.
Safely means that we're doing periodic blood work exams, that we're checking for all sorts of different kinds of things. Prostate issues are critical to look at. Prostate cancer is sped up with testosterone, although testosterone does not cause prostate cancer. If you got cancer, it'll go faster. And so we always want to measure your PSA, your prostate-specific antigen, and it's just a simple blood test. And we also want to look at your blood work and saying, how much, your red blood cell count, and your hemoglobin, and is it your blood getting thicker and all that kind of a thing, as well as the estradiol. So lots of things to be able to balance. And that's why if you're going to do this, you want to have it done by a professional that understands what to look at, so we can be safe.
Yeah, extremely important distinction. I've heard, horror stories of guys who get it from, the guy in the change room at the gym, and it's like that doesn't seem like, this is not a supplement from the vitamin shop, like from the supplement store. Like, it's a little bit more involved than that, and it's not dangerous if you do it right, but it's not intuitive necessarily. You won't even know what to check for if you don't know what you're doing. And so there are things you need to pay attention to, and it is something that you have to then do for forever. Like, this is a rest of your life kind of thing. It's not like, well, I'm a little bit low right now, so I'll take it for the next 6 months, and then
it's not a cycle. You're right.
Yeah,
it's not a cycle like you would cycle a usual sort of like bodybuilding steroid dose,
right,
and then you would go on the SERMs afterwards and then try to kickstart. No, we want to think about that. Like, our testicles do more than just make testosterone. They make sperm. They make testosterone, but they also make a good chunk of our semen, and so we like all those kind of things, right? And so we want to maintain that while you're on that. So I will almost always give human chorionic gonadotropin HCG simultaneously, so that we keep everything going.
And is that the one that also maintains like fertility levels, because I've
Yeah.
also heard if you're on TRT, then your body stops producing everything naturally, so you're relying on the medicine for it, but then you can't conceive children if that was something you wanted to do.
Right. So your brain, it goes, oh, there's enough testosterone. It's measuring the levels. I don't need to stimulate the testicles to make it. And so it shuts down the anterior pituitary gonadal axis. And when that's shut down, your balls are basically just there doing zero, not being stimulated. And what do our organs do if they're not doing their jobs? Well, they shrink, they atrophy. So this is where you get these sort of raisin, balls. And from an aesthetic point of view, that's not good. But from a functional point of view, it's also dangerous. We want to keep them healthy. We want to keep them stimulated at a low level. And that's why it's also important to have this HCG on board, which at a low level sort of keeps them going.
Right. And it's my understanding that is also, I don't know if reversible is the right word, but if you weren't taking HCG and then you started if you were taking TRT without HCG and then you wanted to have children or whatever, then you started taking HCG, it would kind of restart restart your testicles. Is that
yeah? So and that's kind of.
But.
Yeah, no, I mean, that's exactly what bodybuilders do. They'll do a 3 or 6 month cycle. They won't take anything else other than their drugs, which are 99% illegal, i.e., not Health Canada approved and not able to get from a pharmacy. So you have to get it online or
and not therapeutic in any way. They're performance.
They're performance drugs for sure, and then they'd stop it, and then they'd try to get everything back. So they'd be taking HCG and they'd be taking all these kinds of things to be able to increase levels of testosterone naturally.
Right.
SERMs and all that kind of stuff, right?
Yeah. Those things, people ask me about SARMs often.
Yeah.
And my response, I don't know a ton about them, but my response is if you're going to do that, then first of all, I don't think you should do it. But second, if you're going to do it, just do something that's better than that. It's not that effective. Do something stronger if you're going to do that, but also don't do that unless you're really competing in bodybuilding.
Right. Absolutely. Yeah. I mean, 99% of bodybuilders are on something, right? And I get questions all the time, right? Can you get me Mastron? Can you get me Sustanon? Can you get me this? I'm like, no, I can't. I'm not your drug dealer.
Yeah.
These things are illegal.
Yeah. Those things don't have therapeutic use. So even from a doctor, you can't just get them, right? It doesn't work that way.
Right. But what I can get you is, coming right from the pharmacy, coming solid,
right.
We can trust it. We know what's in it. And that's also really, really important. They're like, well, I can get this cheaper online.
Probably.
Yeah, but you don't even know what it is and what it's mixed with and all this kind of stuff. So again, that safety piece is there.
Yeah, no, absolutely. I can't imagine someone I know that people do it, but I don't know why you would just get it from some random sketchy website. You barely even want to buy a phone case from a sketchy website, let alone something you're going to be injecting
into your body. Yeah. For
very,
sure.
very crazy. So aside from the kind of, the medical and drug intervention of these, are there actual, and we kind of dispelled this a little bit, but the lifestyle and societal interventions, are there lifestyle and societal interventions that we can make in our lives that will impact or improve testosterone, ED, and associated things before jumping into medical interventions?
Yeah, I mean, there's lots of studies that show that when you just work out and do resistance training with weights, it can increase your testosterone naturally. We know that. Certainly, there are natural supplements that can also increase your testosterone. The problem is the nutrition sort of natural food industry doesn't have the same regulation as a pharmaceutical industry. And so that means that while it probably works a little bit, we don't know the quality, we don't know the levels, it doesn't have the same thing. There's almost and I understand why. There's a distrust for medicine and side effects and all of this on one hand, and so natural must be better. Right, natural is better because it's natural. But the thing is that industry is not controlled in any way, shape, or form in the same levels. And so, buyer beware. Does it work? For sure, it can work. Is it more expensive? For sure, it's more expensive and usually less activating. It's less potent. You can depend double the amount for something that's natural. It's mixed in with something else, so the potency is way, way less. So I always tend to have a little bit of a balanced point of view. If it makes sense, and if you can't get it, we try to be healthy. Try to get it from your diet, eat well, and exercise well, maximize what you can maximize. And then if there's nothing else that you can do, then go to your doctor and see, or somebody like me, and you can see what can be done and what the levels are and what the treatment options are.
Yeah, there's a big push right now in Canada actually for much heavier regulations on the supplement industry. I'm not sure if you're familiar with this, but it's a new bill that's come out, and there's some problems with it just from like an over regulation standpoint. But I think Canada is probably better than most other countries. As far as our regulation of those. But I think the strength of these things when we're trying to deal with an actual medical issue is different. Like if you're just taking your test booster off the shelf at the supplement store or whatever. What's the one that's like really hot right now is what's it called? Tongkat Ali, whatever. And I'm sure it works. I'm sure it helps a little bit, but if you have an actual problem, like it's for sure not strong enough to fix your issue, right?
Right. That being said, I have to be honest with you. I had a guy whose testosterone was really low. I gave him a beautiful, perfectly titrated dose that would get him up to the high end of the normal range. And he came back and it was way too high when we did follow-up blood work. And I'm like, this dose is not that I'm giving him, shouldn't give him a testosterone level of that. And, I said to him on the phone, I'm like, are you taking anything else? And he's like, well, no, I'm not. I'm like, what about natural supplements? Oh, yeah, I take like 4 natural testosterone boosters. I'm like, okay, you just started that at the same time. I said, don't mess me up for God's sakes. I said, you just put a whole bunch of extra, variables that I haven't, thought about. And so get off them.
Yeah. They're very interesting because they seem, you're right. It seems like it's natural, so it must be safe, but it's also probably less effective. Maybe if you're taking a bunch of them plus TRT, plus working out, plus eating healthy, plus sleeping, plus like doing all the things, then maybe it will work. But it's it's sold as like this, just take this pill. It's offered over the counter, no injections, no doctors needed. And it's like, well, if it was that good, if it was as good as it's marketed as, so we wouldn't need doctors prescribing TRT. We would all just take that and we would be perfectly fine. But logic is difficult sometimes.
Yeah. Well, and it leads me to think about another thing is with regards to erectile dysfunction, where I said that 85% of erectile dysfunction is related to vascular issues. I'll have guys that are coming in that are in their 20s and it's saying, well, I have ED and they're on Cialis and Viagra and things aren't working. And so, I don't go to medical stuff right away, although we will test testosterone. But my very, very first question is, which we need to think about later, is how much porn are you looking at? How much porn are you looking at? And I think it's a really, really important thing to mention, too, because especially with men's health and ED, that is probably one of the single most damaging things that we can do for healthy sex life, because it's almost like intense crack cocaine for your brain.
Right. That
the only way that you can do that is having porn in front of you every day. And then when you come to a natural scenario, nothing happens, nothing works. You don't have that crack, that hit,
right.
And so it's one of the things that we talk about in our clinic, even for erectile dysfunction, is get off the porn. It's no good for you. It's no good for your partner. It's no good for anybody. And here's some options and treatment solutions to be able to do that.
Wow.
So thinking a little bit about laterally about this thing it's also super important.
Yeah, that is not at all what I thought you were going to say is like the first thing that you would ask. I would have assumed, especially if it's a vascular issue, like, well, are you exercising? Are you drinking water? Like, are you doing things that like support your cardiovascular system, which seems like, a very logical thing to do. And I'm sure that that's part of it, but I wouldn't have thought, I would have guessed that porn would probably be part of it, but not a huge part of it. But it does make a lot of sense. I sometimes forget, moderation is very difficult. And so some people will like something, this is not that bad. But if you do it all the time.
Better access to porn than ever before in the history of the world. All right. And so it's a dangerous and a beautiful machine at the same time. But when we're talking men's health, we're all the same. And it's a really important thing to rule out.
Yeah.
So thinking laterally and thinking about other things is super important.
Right. Yeah. And considering your whole lifestyle, I can't remember what podcast it was that I was listening to, but they were talking about how, kids, 10, 11 years old, you have a cell phone now, and all of a sudden you have porn. When, most people, when you were 10 years old, like, you didn't have porn. And if you're a little bit older, then you had to get a magazine and all this stuff. But now, like, 10-year-olds can just go on there before they're even hitting puberty and all this stuff. And their female counterparts are hitting puberty. And that can't be good for them. And it can't be good for anyone, but it can't be good for them, especially starting that young. You would have just like the most crazy interpretations of what sex is and what sex is like and what sex should be. And no wonder you'd be messed up when it comes time.
Right. And, like, our sex life should be healthy, life-giving, mutually beneficial for all of our lives. And putting this little thing in the mix is so detrimental, to that. So I talk about that stuff every day, and we have some great resources on our landing page on our website for porn help and porn addiction, which I got to say is way bigger than everybody thinks.
Right. Yeah. I'm a little bit surprised, but now that I think about it, not that surprised, because people go too far with a lot of things.
Yeah.
Speaking on ED now, more specifically, you mentioned the Big Shot. Can you tell me what it is? It's a very cool name, but what is it?
Well, Big Shot is different than ED. Big Shot is the equivalent, Daniel, of a breast implant for a man. Okay. So women get a little bit of volume in their chests, and they feel more beautiful. They feel more legitimate, whether they have clothes on or clothes off. Yeah, they do. It's the number one cosmetic procedure on the planet. Right? At least in North America. And it's the same with guys. A little bit of, which guy in history, in every culture, wouldn't mind a little longer and wouldn't mind a little thicker? Well, the answer is everybody. Everybody would, right? It's associated with our virility, with our masculinity, with a lot of shame, mostly up here. And so when we first got into this, we thought, is this about sex? And the answer is, it's really not about sex. Having a little longer or a little thicker when you're hard or when you're soft is about confidence. It's about the feeling of legitimacy. It's a feeling of good body image. And so that's really what I'm giving to somebody. Feel better about yourself. Enjoy who you are in your naked. And it's a big deal. In fact, that's why we call it Big Shot.
Yeah. No.
It's a big deal. So I was interesting. I was in a couple summers ago. Maybe it was last summer. I was went to Naples, and just outside of Naples is that ancient city called Pompeii. That was the city that was covered up with that ash when Mount Vesuvius blew up like 2,000 years ago. And they've dug it out, and you can walk on these ancient streets and see the frescoes. I mean, it's fascinating. Anyway, what do they have in Pompeii? Well, they have the cult of the penis. In fact, there was a cult of the penis, and they have little penises etched into their, stone, walkways pointing to where the brothels are. So, it doesn't matter again which culture or it was a big deal. And so what is new is how we do it. And the Big Shot is called platelet-rich gel matrix. Okay. It is a mixture of hyaluronic acid, which is like filler, what ladies put in their lips to plump up their lips. It's also found everywhere in our body, and it's mixed with growth factors from our blood called PRP, platelet-rich plasma. The thought really is that the growth factors sort of hook on to the filler like scaffold and then super stimulate your own collagen. So the benefit of this new technology is it gives us the best of everything. It gives us natural, safe, instant, and reversible. It can be dissolved with an enzyme, but it lasts 3 to 4 years. It's not a 3 or 6 months kind of a treatment. And it degrades maybe 10% per year. And so you do little micro touch-ups for a couple of years, and it's basically, I would call it semi-permanent kind of a thing.
Interesting.
And it's done within about 25 minutes, and it makes a soft penis thicker and longer, and it makes a hard penis bigger overall.
Right. And it's just a single shot. That's all it is.
Yeah. So it goes in with a cannula in between a space. So it's underneath the skin. So that means it doesn't affect the sensitivity of the penis, and it's on top of the erectile tissue. So that means it doesn't affect your erections at all. So it's in that potential space. So it's almost like kind of walking around with a semi. All right, it's not allowed to shrink up when you're cold or like anxious, kind of a deal, right? And we all kind of understand that and laugh about that. But like it's one of the main reasons that after you're in the gym and you're going to have to go to the shower, that you hide, you cover, because you're a little bit retracted and that kind of a thing. And so this keeps you out there, held out there, and doesn't affect sex, and feels pretty great.
Yeah, the mentality has got to be the main thing. Like my first thought, kind of equating it to a breast implant, is that when you're in your regular, day-to-day life, if you're wearing a t-shirt or, in your normal life, you can see the size of a woman's breast roughly, right? You can tell because it's on the external part of your body, and so is your penis, but it's like in your pants, and you can't walking around, no one knows anything, but yourself. And so maybe that confidence, like by the time, I'm thinking by the time a woman sees your penis, she's already gonna have sex with you. So you've already, you've got to that part for the most part already. But you may not have had the confidence to approach, to ask for her number, for whatever comes with that. So that's a really interesting kind of way to position it. But I mean, it makes a lot of sense. Like you said, like who wouldn't want that? no guy in the world wouldn't want that.
And wait a second. What's the biggest trend right now in fashion? Athleisure. What is athleisure? Freaking wearing sweatpants more than we ever have before. And, to be able to see a little imprint or a shadow on a penis, we absolutely can tell if a guy's packing some heat pretty easily, Certainly, male anatomy is sort of the last bastion of something that we show or we sort of think about or you want to brag about. But at the same time, there is a word for it, and it is called cocksure. It's kind of like being naked in front of 2,500 people and being completely confident. It is powerful because that confidence is, I'm so cool with who I am. I'm so cool with my anatomy, and it's not about showboating or trying to be an exhibitionist, but there's a confidence that comes, and that confidence, exactly to your point, can go into relational issues, but just being cool with who you are is a powerhouse thing to be able to give to somebody.
Yeah, I mean, confidence is going to extrapolate across the rest of your life, your job, your everything. It goes over everything. This is also very much in line with some of the regenerative medicine that we were kind of mentioning before. Like PRP it's not brand new, but it's like becoming more popular, let's say, for various things, not just injury healing, but it's becoming a lot more, and in conjunction with some various stem cell therapies and for tons of things. So this is kind of like right in line with that, right?
Absolutely. What can we do to regenerate our tissues and make them more robust and younger looking and healthy? And PRP is, growth factors from your blood. The next biggest push right now that's on the market and available in Canada and the United States is something called exosomes. Exosomes are the growth factors from stem cells. They're probably about somewhere between 5 to 10 times more potent than PRP. And right now it's not legal to inject them, but you can kind of stamp them in as skin treatments. And this will be, and you can use somebody else's exosomes. They're not cellular, right? So I could use yours, for example, right. Which is cool. Stem cell treatment is about 5 to 10 years away probably from being both Health Canada and FDA approved with the testing. But right now, for example, they are growing skin that grows hair in Asia from stem cells, right? I do a lot of hair transplant in my clinic, and we're always limited by the donor and the back and the sides. But I mean, if you could grow as much hair as you wanted from your stem cells, that would be cool. There's 10 people walking around the United States right now with 3D printed bladders from stem cells. So the technology exists, it is there, and it will change everything as we know it probably within 10 years. Yeah.
And it's already, there are other countries or areas of the world where these therapies are a little bit further ahead in the approval process, right? I think that I want to say Dubai is one of them, and even Italy might be one of them.
Yeah, just like with everything, you could go down to South America and get things like this done. There's value in waiting. I mean, what was the biggest trend 20 years ago? Cloning. Everything was going to be cloning. We were going to clone. Remember the sheep Dolly? Dolly was a clone. What happened to Dolly?
No
Well,
one
Daniel,
knows.
Dolly's freaking dead. Okay, Dolly died of cancer because we cloned her, and then all of the oncogenes, the cancer genes, got brought to the top, and she died of like fulminant cancer.
Right.
And so, while it's possible, it's always good to be able to souse out someone like, what happens if this goes wrong?
Right.
We should probably do some more testing before we make everybody have it.
Right.
And so there's always going to be some value to that. And so the early adapters, they might have the benefit of getting treatments earlier, but they might also be at risk for developing and showing us what could go wrong. And so I'm kind of in the middle. Like, that's not, I don't think we need 25 years to do a treatment, but let's test it properly or have some good studies before we let that go. So, but it's definitely up and coming, and it will be a game changer. People want to talk about it. Certainly, we're offering treatments like that.
Right. Yeah. For cosmetic stuff as well for like more
knees and orthopedics and hair growth and skin and all this.
Yeah. That's what I was saying. Before that, I'm so excited about this. Just the knees is like joint stuff for me. It's like there's no way to heal it the way that I've mangled my body, and that is the kind of the last thing. Are there any downsides to the big shot? Well, like is there any dangers of this? Like what's the downside?
The risks are really, really low because it goes in a potential space, kind of underneath the skin on top of this. We're not getting into blood vessels. And if you do it properly and have it done by a professional that's been trained properly, it's an exquisitely low risk procedure. Infection risk is low. I do give antibiotics as a precaution just in case. The risks of vascular occlusion, getting into a blood vessel, we wouldn't want to plug up a blood vessel. We want it in that space, are also low because we got to use something called a cannula, which is a blunt tip needle that can't poke through a blood vessel. It would just go around it. And so those would be sort of the ones that would be the things that we would think about the most. Infection or vascular occlusion, super low. What do I say is what's a potential risk factor? I'm like, beauty. Beauty is this. In my consultation, I usually say this. Consultation goes, I'm going to have one right after we finish this podcast. I'm going to say something like this. Consultation will go from weird to weirder to I'm your best friend. All right. Because it's odd talking about this kind of thing. It's very personal, and all of a sudden you find someone that can align themselves with you and sort of think in the same way that's driving you crazy, and then be able to help you. I've had guys cry. I'm like, I can't believe this has been my biggest insecurity all my life, and we just fixed it. You changed my life, kind of a deal. And that's a kind of a cool thing. I'm like, you always remember me.
Yeah, exactly. I mean, it sounds to me like, some of the risks or downsides are like the same risks or downsides as any procedure ever. Like any type of surgery you get,
getting your lips done if it was injectables, or having a facelift or something like this. But it's much lower than that even.
Right, less invasive, yeah.
Because it's less invasive, and it takes about 25 minutes to do. In general, it's not surgical, all right? And so I'm kind of maximizing your potential. So, we're not cutting anything. We're just basically making your penis as big as it can be. So this procedure is sort of the best done for the growers, not showers. Right. So, most people in general are comfortable with their erection because, there's usually a prize at the end of that. But it's just that when they're not that way, they're like, dude, little buddy, what's happening? Come out of the cave, right? It's so to be able to do that. So that, and it's so funny because, whether you're 3 inches, 6 inches, or 9 inches, it doesn't actually matter. I mean, I've had a guy come in with a 9-inch penis and he knows it's long, but it's friggin' skinny like a pencil, and he's so embarrassed, right? So, from an artistic point of view, it's about proportion, it's about the lay and the lie, and really it's penis art.
Right.
So we sort of think about this as penis art. We want to have a nice, even, smooth-looking tube when you're soft and when you're hard, and something that, a guy can be like, wow, I feel great about that. Right. So super risk-free, super low downtime, lasts a long, long time. But, I've had some guys come back and say, you know what, I love this, but my partner thinks it's too much. So I've reversed it for that. And then he cried, and then he came back and broke up with his girlfriend and got it again. So interesting. This isn't about you. This isn't about her. This is about you. This is about you.
Yeah.
Yeah. So it's like stuff like that, right? I mean, it's multifactorial because that organ has lots of different interfaces, and so considerations as to all of that.
Right. I mean, you bring up a good point about, people who become your best friend after this, or you become their best friend type of thing. And it's like, we talk a lot about mental health in society now, and I think that we should, and it's it's a big topic, but sometimes like the thing that you might need is not necessarily just talk therapy or speak to a quote unquote professional. Like that professional can be a lot of things. There's people in like the fitness space that I see that say like, oh, the gym is not therapy. And it's like, yeah, it's not talk therapy, but it might be the thing that like really helps the person. And maybe talking to someone didn't work for them. Like, who are we to say that, there's one size fits all for therapy as well? It may be the gym. It may be getting the big shot. It may be many different things that it's like, that's that one trigger that helps you, get the ball rolling and really just get your life back and be you. So, we kind of laugh about it because it's funny and maybe taboo a little bit to talk about penises and whatever, but it's very, very real.
It for sure is real. Absolutely. And talking about it usually brings like, a different perspective or a bigger perspective. And sometimes when you're hyper-focused on something, that bigger perspective is so important for be able to say, okay, I needed a shift in my outlook. But sometimes there's still a problem, and deal with the problem if there's a problem. My rules, safe and natural. Safe and natural. Whatever we do, safe and natural. And so if you can fix it, fix it. And if you can, accept it. I haven't been to Alcoholics Anonymous, but they say that there, but it makes sense.
Yeah, no, for sure. Yeah, I didn't mean for what I said to be misconstrued as, don't go to therapy and just go to the gym and get the big shot. Like that may be the thing. And maybe it's multifactorial, and probably it is multifactorial, whatever's going on with you. But no matter what it is that's going on with you, like, do something to try and help yourself. Like go, seek help from various professionals, whatever you think might work for you. I think that's like, the best place to start. Don't just listen to what everyone else says, right?
1,000,000%.
Is there anything that you think that we've missed as we're, kind of winding down here? Is there anything that you feel that we've missed on the topic of ED, testosterone, the big shot, anything that you wanted to cover that we didn't get into yet?
No, I think we covered a good range. My general message is live your best life. If something's bothering you, find out who you need to talk to. Come and talk to me. We can talk about everything. Male health, male sexual health matters. It's a big part of our life. We want to do it in safe ways. We want to do it in safe ways that protects you and your partner. And just getting out there and talking about it, just like we're doing today, super important. And I just want to thank you for the opportunity to be able to do that with you and your podcast. Awesome. Thank you.
Of course. No, thank you. It was a pleasure. I appreciate your time. Where can people find you, get in contact with the clinic? I'll put everything in the show notes, but if you want to just kind of rattle it off here for people.
Yeah, best way to contact me is through my website at sovereignmale.com. We also have another website called The Big Shot, one word, thebigshot.ca. And you can find me and information about our services and our clinic on both of those platforms. It's a pleasure. Thank you.
Awesome. Sovereignmale.com, thebigshot.ca. I'll put all those in the show notes. Dr. Torgerson, thank you so much for your time. Is there any last message that you want to leave the people with here in closing?
Live strong.
I love it. Good one. Thanks again, Dr. Torgerson. Thank you, everybody, for listening. I appreciate each and every one of you. Sovereignmale.com, thebigshot.ca. Everything will be in the show notes. Give me a follow as well on Instagram while you're at it, at Daniel Yoris. If you're in the Toronto area, please, and any of this spoke to you, please go visit Dr. Torgerson down in Yorkville. Share this episode with a friend who might want to hear it. Ladies, the men in your life probably need to hear it. And men, share this with your friends, because talking about it more is what helps all of us. That's all. Please rate, review, subscribe to the podcast. All those good things helps get the message out there as well. Go outside. Be a good person. See you next time.